This is Dr. Nick over at SCR3, and today we're going to be talking about some of the taping strategies that we can use in order to support some of our pulleys and some of these anatomical structures that get injured during climbing. Today we're going to be talking about the H-tape method. It was developed by a guy named Volker Schöffl. He's an MD, and he originally developed and did a lot of the research on this taping method. So we're going to want to start by taking our leukotape. So leukotape is this kind of tan color tape, which is a lot stiffer and more inelastic than a lot of the other more generic brands on the market, such as that kind of like white athletic tape and things like that. This one really won't stretch as much as that white athletic tape will. Pull about 3 or 4 inches of length, and we want the tape to be about 1 inch in width. So what I've done here with my roll of tape is I've cut myself a section for just the H tape in general, and then I've also got myself a nice little accessory little side piece which we might use later. This tape is going to be a little bit stiffer and a little bit more difficult to cut, so I'll a lot of times use scissors. Ironically, these kindergarten scissors work pretty well. And then what we want to do is sort of start to format that H. So you can tear right along the aspect that you just cut. And we want to leave about 1/2 inch in the center, which makes the bridge of our H. So you can also use the scissors just like so. So now I've created my H here, as you can see. So what we're going to do is we're going to place the bridge of the H over where the A3 pulley is located. So here we're going to have A2, A3, and then A4 pulleys underneath the hand. What they found is that this taping method is especially good at supporting where the A3 pulley is, and it is most effective when we place it over where the A3 pulley is. So really want to tack that down, making sure that our hands are nice and clean, not covered in chalk dust or anything like that before we begin applying the tape. Put a nice bit of flexion in the finger, approximately 60 degrees, and then we can wrap the more distal ends of the tape. We want to wrap it pretty tight, but not too tight that we begin to lose circulation, because this tape will not stretch very much. So if we start out and we have no circulation, then we're probably going to end up with no circulation while we're climbing, which is not a good thing. And then we want to keep that flexion there, and we want to do the more proximal band here. Like so. So then we've got that kind of looped very nicely over our finger. Now, one thing that we can use that sort of accessory side piece for is you'll notice you've got a couple of sort of loose ends with the tape. So we can take this. We can begin on one section, and then we can just tape those loose ends down so they don't end up flapping around while we're climbing, leading to the tape kind of coming off. So you go around like this. Bringing it around again and finishing up just like that. Now we have to remember, this tape job isn't protective of injuries, so you don't really want to go into the gym and spend, the first 20 to 30 minutes of your climbing session H-taping every single one of your A3 pulleys. You'd really just be wasting a lot of your time. So what this tape is the best for is supporting some of the structures minorly while we're maybe experiencing a bit of a tweak in the finger, a bit of a low-grade pulley strain, or if we're recovering and we're starting to get back into climbing from a higher grade strain. That's all I've got for you guys today, and enjoy climbing.